National Minority Health Month began in 2001 in order to address the growing health concerns of minorities all over the nation. Since then, its goal has been to unite communities and provide awareness about the prevention and early detection of deadly diseases that affect minorities in our community. Joining me now to tell us more about minority health issues is Dr. George Smith with the Escambia Community Clinic. Dr. Smith, thanks for being here.
Thank you, Jeff. It's great being here.
Well, before we get into this conversation, let's talk a little bit about the clinic itself. I know we were talking earlier, there's some confusion with the health department and the clinic. Tell us a little bit about the clinic itself.
Well, Escambia Community Clinic was actually started, I want to say, maybe 22 years ago when the old University Hospital closed and Sacred and Baptist came in and got this started so that they could continue care for the underserved and uninsured. Since then, we have grown and we became a federally funded community health center 4 years ago.
Great.
And the growth has been exponential since then.
Well, great.
We're located at the 2200 North Palafox at the corner of Palafox and Maxwell. And we've been at that location for the past 18 years.
Okay. Well, thank you. Well, as April is National Minority Health Month, let's talk about what are some of the disparities? Why is there a need to have a month focused on that particular issue?
Well, that's a good question, Jeff. In the CDC Office of Minority Health stated that in 2004, African Americans had the highest age-adjusted death or rate of any ethnic group. In addition, we have the highest age-adjusted death rates for cardiovascular disease, for hypertension, for diabetes, for cancers, and HIV. And I think that's pretty much some of those diseases that are reflected in our community.
Well, why are these disparities, why are they so prevalent, I guess?
I think there are a number of reasons. I mean, there are genetic and biological reasons, but I don't think that that alone accounts for the disparities that we see. Certainly, socioeconomic reasons exist, in particular, education. Lower educational status is a big contributing factor. There are obviously genetic and biologic issues, and there may be some discrimination as well. What
about, you mentioned socioeconomic, but just what about like diet and you mentioned education, but just access to information. How do those things fit in as well?
Right, and I'm glad you mentioned access. Certainly access to healthcare is a big part of that. But when you look at the lower socioeconomic levels, education plays a big role. So in the lower socioeconomic groups, health behaviors are different. Choice of food, the lifestyle, and diet are a big contributing factors to some of these disparities.
Well, what are some things that can be done to prevent some of these conditions that you've referenced?
Well, that's a big challenge. But certainly I would say that we could start with education. I mean, we definitely need to seize opportunities, certainly in the healthcare arena. When I see patients, or when physicians or healthcare workers see patients that come in, it's a good opportunity to take that time to discuss health behaviors, healthy choices in terms of diet and exercise, and just to discuss the complications that arise from some of the chronic diseases that are prevalent in the minority community.
Do you find that most people are welcome to receiving that information?
I think so. Most of the patients will want to hear about what they can do to improve themselves, what they can do to minimize some of the complications that we know these chronic diseases
well, one of the diseases that you mentioned is diabetes. Tell us a little bit about that and how it affects the minority population, and what are the factors in there. You mentioned some genetic, some behavioral.
Well, certainly type 2 we know has a big genetic predisposition, and the underlying condition obviously is insulin resistance. in addition to that, you also have the beta cell dysfunction that occurs in type 2 diabetics, and so that plays a role in contributing to the diabetes. No, what was the question again?
No, and what about hypertension? We mentioned that one as well.
That also has a high genetic predisposition as well, but certainly diet, exercise, obesity has a lot to do with both hypertension and diabetes.
Now, are these things that can be controlled by medication, or should there be lifestyle adjustments that come first?
We rely on both. Certainly, in a very early diabetic, we can implement lifestyle changes, and in some cases that may be adequate to control the diabetes. But we definitely use all modalities. We'll use the lifestyle modifications, lifestyle changes, and medications.
Mm-hmm. Well, what would you think is the most important thing that you would like to get out here today about this month and why it exists, and maybe why someday in the future it might not need to exist?
Well, as I said, it is a complicated issue, and we for one thing, we need more minority healthcare workers. We definitely need more. I think patients are a lot more comfortable with healthcare workers and physicians and nurse practitioners that are of their own culture or ethnicity, and sometimes that plays into how we communicate and how we treat patients and their belief and what they will accept from the other person. So that's a big challenge. But if we can train more minority healthcare workers, that's going to be one of the a really useful way to attack the problem.
Okay, well, great. Well, that is certainly the communication and the cultural part that you mentioned. Well, before we wrap up, would you like to remind everybody again how they might contact someone at the clinic?
Certainly. Our number is 850-436-4630. You certainly can call the clinic. We're open 7 days a week, Monday through Friday from 8 until 8 for urgent care, and 8 until 6 on the weekends. And we also see patients by appointments 8 to 4 Monday through Friday.
Okay, well, it's great to know that you're available on the weekend. I didn't know that, so I learned something more today. And thank you very much. I know you've got a very busy schedule, so we appreciate you being here.
Thank you, Jeff.